The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on virtually anything you'd like to talk about your health. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you. Perhaps you've had a problem. You've done everything you can think about and come up with the same old, nothing that works. Well, here's an opportunity. Let's see where we can make a difference, without drugs or surgery. We have an interesting program for you today on this absolutely gorgeous, gorgeous fall Washington, D.C. area day. It's gorgeous outside. Matter of fact, some of you are watching the Marine Corps Marathon, and some of you, like me, wonder how they do this and just figure out, maybe next life I'll get out and be crazy enough to do things like that. But nevertheless, we have a program. And the program is about all these things that make your head go bad. Your brain function, your capacity to think, your ability to use judgment, your reactivity patterns. And, as we get older, we kind of blame age on that, but not necessarily so. And more than likely, it's not that. It's injury and capacity and chemistry over time. And it seems that we get older, that's the culprit, but it really isn't. It's something that we've ignored for way too long. And we're talking about your brain on fire. We've touched upon that many times on the program, but very importantly, and that we try to get the best of the best. And in studio today, I have the best. I have the guy who is the expert in brain health, someone who has become a friend, someone I met over, I think it was almost about a year and a half ago now. And we're talking about Dr. Dan Johnston. He's a 20-year Army doc. Colonel Johnston has a tremendous background, from leading up cutting-edge programs in resilience and performance for the U.S. Army. He worked at the Pentagon's, been into the White House. He has worked for the Office of the Surgeon General and served overseas in Iraq. Having said that, this man has an insight and has developed a company called BrainSpan that has the capacity to really look at what's happening with your brain. More prognostic in its application in the work that we see with injuries and chemical insult and stress over a long period of time. Here's an application that really makes a difference in the direction that we can treat. Are we getting things done? Are patients improving the way they're supposed to? Having said that, I'll quit running my mouth. Dr. Dan, welcome to the program.
Thank you very much. Thanks for having me.
Oh, you're welcome, my friend. This last time you and I spoke together was last spring, and we had a house full of people. And this Wednesday evening, you're going to you and I will co-lecture again, and at the Roselle Center for Healing in Fairfax. We have no idea how many people are going to call, but you're welcome to meet this amazing man, and we're going to talk about the brain. We're going to talk about inflammatory reactions. We're going to talk about this test that he's developed called BrainSpan, and it's a really simple, straight up, program. Dr. Dan, before we go much further, let's talk a little bit about, your background and how did this all come about? What was the impetus, if you will, to create this company that is something that we're using all the time now in our practice?
Yeah, well, it's a great question. Thank you again for having me. And I think really what has led me to develop this and really what served as the inspiration is really my experience around the Army and looking at the role that nutrition plays in the readiness of our military. And while the U.S. Army and the U.S. government certainly doesn't necessarily endorse BrainSpan, and the things that I'm saying today don't represent the views of the Army, I did have that experience that led me to really understand what is the most important ingredients to brain health, brain resilience, and longevity of brain function. And what are the critical nutritional ingredients that really lower that inflammation? I like what you said about brain on fire. Well, our bodies are on fire. Our brain is on fire because of the way that we eat here. And so when I really began to uncover those key ingredients, it led me to develop really what I consider the most important test that people need to do, which is understand what are those critical ingredients that lower that inflammation and that promote that longevity of health. And so that and they're very basic things that we consume every day, but nobody knows whether or not they're getting enough.
Right. Dan, let me ask you a question. You spend a lot of time overseas. You've dealt with a lot of our military that coming back, and years ago we used to call it shell shock. Now it's PTSD, and we know we've had the fortune to be able to help many of these guys coming back, but it's a combination of things that lights the body up. Anything from persistent injury. They've been hurt on the battlefield. They've lost part of them. The things that they've seen, the horror of that, the stress of having to do their job, not setting aside the fact that food ain't very good out in the battlefield. So you have this combination of structural, chemical, emotional, and, can you set aside one or the other, or are they all together?
They're all together, absolutely. And that's the problem, is that in traditional medicine, we've separated those, and thankfully people like you who are saying enough's enough, and these things all work together, and we need to treat them that way holistically within our patients. And then when people can really make change. And, when I was over in Iraq in 2010, I looked at the way that we were eating, and I said, this cannot be the optimal diet for producing a high level of performance that we need in our soldiers, and also resilience to these emotional problems that so often result from difficult situations that we face, whether it's a deployment or a breakup or a job change or a move. We need to have resilience, and it's our food that can play a massive role in providing that. So when I saw that, I said, I need to look into this, and did a study when I was over there, and sure enough, uncovered that these critical, what we call fatty acids, are what we need to be giving a lot more attention to.
I want to get into that in a second. My guest in studio and my co-presenter this Wednesday evening at the Roselle Center for Healing, we're talking about brain health and really what happens when your brain begins to degrade and you have all those problems with not only forgetting things but emotional upset, your ability to be able to be very logical and judgmental and so forth. We often hook that up to getting older, and it really isn't. It has a very specific timeline, things that we've forgotten about, that we've set aside, small injuries, our diet is horrible, we're exposed to electromagnetic fluxes, things of that nature. But in studio, Dr. Dan Johnston, Army doc, getting ready to retire in about another 8 months down the road here. And we have the fortune of being able to cooperate with him and utilizing BrainSpan, the company that he set up. 888-630-9625. That's how you find us here. And this Wednesday evening at the Roselle Center for Healing, go online, go to rosellecare.com. That's ROSELLECARE.com, and register for the class. There's a bar that says register now, or simply call 703-698-7117 and tell staff that you'd like to be there. And remember, the last time we did this, we had to move out of the office and go to the hotel. So this guy is a wealth of knowledge and information, and it'll give you the capacity to really look at it from a little different point of view, the chemistry behind it, what happens, the stacking of from injury to dietary patterns to stress and emotion over the top, and now you've got a problem that you normally wouldn't see. Dr. Dan, let's talk a little bit about what was the background that allowed you to identify or become suspicious that there were certain elements within the chemistry of the body that if they weren't present at high enough levels, that the brain, the neurological system was susceptible, but also that there are certain things that could happen that would cause these things either to be depleted or cause the body to break down?
Yeah. So really it was around 2009, the U.S. Army, as well as other branches of the military, I'd been in, protracted operations, overseas engagement since 2003, so 6 years, and we were seeing that take a toll on our returning service members and their families as well. And there was a lot of effort being looked into not only treating some of the things like you mentioned, PTSD, depression, suicide. How do we manage these when they come back? But what can we do to actually prevent them? And that in 2009 led to a conference at the National Institutes of Health, called Nutritional Armor for the Warfighter. And I attended that, and it was, really saying, what can we provide as sort of armor to our internal armor to our military before deployments and before operations. And what rose to the top during that conference for me was seeing the tremendous amount of science behind fatty acids, specific types of fatty acids that we have, like you mentioned, kind of alluded to. We have huge excesses and problems with our Western diet, and we also have huge deficiencies in other fatty acids that we really need higher. And so during that conference, it was, these are the key ingredients to providing that armor. And so when I learned a lot of the science from various experts all around the world, and then I deployed, I tested these fatty acids. I was able to get a research project approved. We tested these fatty acid levels in soldiers, and we asked them questions about their diet, and we also saw how they were eating, and then we measured the function of their brain while they were over in combat. We were able to test and see, and then we were able to draw very, very important associations. So it was really the combination of multiple important experts that I heard from, and then my experience in combat, and then doing that research project that made me uncover these critical foundational nutrients that most people have no idea.
It's very heartening, to see this type of knowledge begin to evolve basically in traditional allopathic community. And I say that with, tremendous respect to you, because we've gotten to know each other and I know how your head works. The thing that is that, up until now, this was set aside. It wasn't even looked at. It was poo-pooed. There's even, there's docs out there in many different professional areas that say nutrition diet has nothing to do with anything. And, you see the shift and change. We know that people who are deficient in not only the anti-inflammatory omega fatty acids, the 3,6,9s in the proper ratios, but also because of the depletions and then the subsequent dampening of things like taurine and GABA and which are neuromodulators. And the thing that is that unless you can fix those, when you're fixing structure, when you're fixing other things, they don't get fixed, or they get fixed minimally. And that was the thing that was exciting when I met you, and that we started talking about, a simple finger prick test that was able to give us a dimensional look at something that we were telling patients, but in other things, if we ran the test, they were very expensive. This is not.
Yeah, that's exactly right. It's the allopathic medical community, like traditional MDs like myself, we just don't get that much training in nutrition. I think I had a week or two out of 4 years. Wow. And that was, so, what I have learned, and by, like I said, going to different conferences, is that it's the people like yourself, PhDs, people who are integrating and understanding that structure drives function. And guess what? Structure is determined by our diet. We're
coming up to a break. My guest in studio, my co-host this Wednesday evening at the Roselle Center for Healing, Dr. Dan Johnston, head of brain span. We're going to talk more about that. Coming up to that mark where we got to take a minute and say thank you to those who bring you Dr. Tom Roselle Live. Don't go away. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. Give us a call. Got a real special program today. I'd love to answer your questions on anything. Particularly if you notice that old noggin of yours isn't working the way it's supposed to, that your memory is kind of in slack, or, you've been getting treated for all kinds of things, but things just aren't working the way they're supposed to. You're stressed out over the top, and you're on any kind of psychotropic drug, to try to modulate things. It ain't working, actually making things worse for you. Well, here's an opportunity. Why? Because in studio, I have a very special doctor and good friend, Dr. Dan Johnston, who is an Army doctor, is getting ready to call it a career after 20 years come this spring, but more importantly, it's the opportunity that he's had to see things that, and put it into application that most physicians would just let go by the wayside. Brilliant guy, met him about 18 months ago. And what are we talking about? We're talking about the inflammatory reactions, brain on fire, nervous system on fire, that has to do with chronic pain patterns, dietary indiscretions, and stress patterns over a long period of time. Having spent some time in Iraq, he got to see what happens, to our military, to our soldiers coming back in country after being exposed, having been injured, having been stressed out, having eaten, in most cases, a very poor diet, and the ramifications, and being able to measure these through omega fatty acids and other different types of neurotransmitters that are specific. He's developed a company called BrainSpan that is very specific in cognitive correlations to these omega fatty acids and other nutrients. Dan, welcome again.
Thank you. Thank you very much.
Let's talk a little bit more about how did you begin to put together the relationships. You saw X happen, and what made you think that it had a connection to all these things that you measure on your test?
Well, part of it is a lot of it is common sense. When you really look at the way our bodies are made, designed, if you look at our cells and the way our the chemical makeup of our cells and how cells are built, constantly in your body, you've got cells being formed, and how does that happen? You have to have the right building blocks, and so the building blocks for cell function, and like you said, this idea of inflammation. People, Americans, most of your listeners are literally walking around on fire, so to speak, internally, because these building blocks also control the inflammation. So there's two things: the structure of the cells and the level of inflammation in our cells are controlled by these fatty acids. So that's just the way our bodies are designed. And then what we did was measure those. And understanding that the cells in our brain function based on having the right cell makeup, we looked at the function of their brain. And then when you see that the connection right there in front of you, once we looked at all the data, and it just physiologically makes sense, you realize that most of the, like you mentioned it earlier, most of the medications that people are on are really just a reaction to this improper structural integrity and improper inflammatory balance. So why not just fix that right away? Measure it, understand it, and fix it, and then worry about all the other things versus just trying to cover it up or react to it with medications.
So, question, Dan, you're measuring these pieces. I'll ask you a question that a lot of our patients have asked. How accurate is the test?
Very, very accurate. I was very fortunate when I did this study in Iraq, and of course had no commercial interest in any, lab testing. I had to look at all the different methods out there to test. Now, I knew it had to be a finger stick because we couldn't, we're over there in combat in Iraq. We couldn't have soldiers who had, full-time military jobs coming in and having to draw vials of blood. So it had to be a finger stick. So we looked at really what's the best method in the world to get a couple droplets of blood, put it on a card, and mail it to a lab in the U.S. and get a reliable. So we did a lot of analysis of methods and labs, and turns out a gentleman named Dr. Bill Harris out of South Dakota spent 30-plus years, hundreds of research articles, understanding the right way to measure these and what those levels mean.
Brilliant guy.
Yeah, brilliant guy. So we were able to partner with him later and develop something that, he spent his life doing the research, but I felt it's time to bring this very easy, affordable way to measure these fatty acids to the masses. And so it's been a great partnership.
Information application come together is astounding, and then you get a guy like me who's a clinician, and I grab that stuff and I tell patients, I say, I'm a great monkey. I take everybody's stuff. I know how to synthesize it. I know how to put it together and apply it accordingly. But here's a situation that we can measure. We tell patients all the time, you're being broken down because you've been injured, because your diet stinks, and you're stressed out, and you're not doing anything to make a difference. So now we can show it to them. But not only that, it's not, and I'm going to go to this place because you and I have talked about this. It's not diagnostic, it's predictive. It's very prognostic. Where you are right now shows us that we're seeing things break down, but if you keep this up and you don't get these things fixed, if you don't get rid of the pain, these inflammatory markers, no matter if you keep putting the things into it, are going to not go away. We're coming up to a break, and I'm really excited. Dr. Dan Johnston, my guest in studio, my co-host and presenter this Wednesday evening at the Roselle Center for Healing. We're going to talk about the brain and really how to measure it. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live in studio. It's beautiful outside. Matter of fact, if you're going to go for that walk or that drive, either do it after the program or put your headset on so you can continue to listen to this amazing program. Why? Because I have, arguably an expert in brain health and the measurement, the predictability of what's going to happen to you if you don't get this thing under control called your chronic pain, your stress, and, the garbage diet that so many of us are linked into because it gives us, that emotional stroke. Dr. Dan Johnston, an Army MASH doctor, 20 years coming up and going to retire. He's created a company called BrainSpan. And what does this do? Many of you who are patients have already had the test. It's a finger prick test and a cognitive reactionary test that measures omega fatty acid levels and other different type of neurotransmitters within the body. And it's very predictive of things that can happen over a period of time. Cognitive tests is very fun, and people get frustrated because they're not able to get through it. They yell at you, Dan, and they take your name in vain. And we try to tell them that it wasn't you; it's just the environment. When I did that interreactive test, I did it in the environment that I'm always in. So I did it at my kitchen table. My grandchildren are screaming and running around. The television's on. Everybody's talking. So I wanted to be able, because I'm like that all the time. I'm either on stage and I'm teaching, I'm traveling someplace, I'm dealing with doctors. I'm sitting at my desk. I'm texting, and I'm on the phone at the same time, and I'm on my computer. So
that was your controlled environment. That
was my controlled environment. It was interesting. We're going to see what happens, because when the test came back, there were some areas that I needed to improve upon, but that goes with things that I've talked to you about, with a couple major accidents where my body for a long period of time was in pain on a day-to-day basis. Hit my head in Las Vegas on a marble pillar coming off an escalator. Head-on car accident some years ago in Herndon. I thought my wife was dead in the car. And those things, the only thing that saved me really is my diet is really very good, and I do exercise on a very regular basis. But the stress of practice and, seeing the patients that we see and so forth, all those things. So, I saw that relationship, and I take very high levels, by the way, of fatty acids. Mm-hmm. So I doubled them. I mean, some of them I got up to in the neighborhood of about 30,000 units a day, 30,000.
The right ones.
The right ones. And, it was interesting. And I bring that up only because of the fact I deal with that and we test our patients. But sometimes, a doctor has a fool as his own patient. And, when I try to treat myself and making sure that I'm taking the right things. But for me, that was significant. And it was very, very, important. This Wednesday evening, you and I are going to share the platform at the Roselle Center for Healing, and like to invite anybody and everybody that's listening to give us a call at 703-698-7117 and check this thing out. See what happens when you've got pain patterns that don't go away, or you're not being treated properly, your dietary patterns are really off. How this thing can be predicted, and Dr. Dan's going to be there, and we're going to talk about this thing in detail, mm-hmm. and we're going to get into it in specific. Who developed the interreactive test?
Yeah, that's so the outside of that finger stick blood test, every test kit has the ability to use your iPhone or an Android or a tablet, and there's no special software. You just go on the web and you access about a 15-minute on average kind of a challenge. We don't like to say test because people get nervous when you use the word test. So it's really a functional challenge. And that was a instrument that was developed by really a huge group of researchers over in England. And they put together what is referred to as the Brain Resources International Database. And the reason they put that together is they actually got about a $30 million grant from our pharmaceutical friends who wanted to have a database for normal brain function. We didn't really know, based on age and gender and educational status, what is normal brain function. So whether you're a 10-year-old or whether you're 40 or 60, we didn't know what is normal. So that was the goal of that project, was to develop a database of really well studied normals. And they did this test, but they did things like MRIs, they did genetic testing, they did blood work, they did, standardized long questionnaires. So that way, once we have a nice big normal data set, when you or one of your listeners takes this test, guess what? I can tell them, based on their age and their gender and their educational status, where do they fall? Are they above normal? Are they basically normal, or are they below normal? And that's the thing. Nobody really knows where. Most people do not have any idea whether or not their brain is working day to day like it should. Well, this test at least tells you whether or not, based on this huge database, you are doing what we would expect. And if you're not, then we can get ahead of it way before any disease comes in.
Some people expect that, the progressive decline over time, and I don't like to use age, but it's over time, because of all these factors that we've been talking about, because of the constant environmental stress patterns, sometimes abrupt stress patterns that make us go into spin. The dietary patterns of this country, unfortunately, the United States ranks somewhere in the number 27 or number 28 wellness on a wellness quotient of 35 industrialized countries that are measured. That's not okay, and we spend far more money than anybody else. You'd think that we would be in a good place, but our dietary patterns have been so destroyed over a period of years. And so when we see repetitive injury, we see people who do nothing today. They're sitting on their duffs, they're on their pads, or their devices, and it's a constant ongoing insult to the body. Subsequently, what you have is this high inflammatory cascade, this brain neurological system on fire that just can't heal anymore. It just won't do it. Let me ask you a question. With a diabetic neuropathy, somebody who has, that numbness, that tingling, that burning, and so forth. You listen to radio today, there's people out there saying, and we know that laser will help, and we know that there are other pieces that make a difference. But can you correlate, can you measure somebody who has a diabetic neuropathic pain with decreasing levels or not adequate levels of omega fatty acids and other neurotransmitters?
Yeah, 100%. If you think about diabetes, and in this case you brought up there's actual and really a side effect of having diabetes is they've got some nerve, in the example you gave, like some nerve problems. Diabetes is really a disorder of metabolism, right? You're not metabolizing sugar, and then there's all the problems that can happen because of that. So then there's those sets. So when you think about metabolism, the one piece of machinery in every one of our cells that controls that is our mitochondria, something called a mitochondria.
Right.
And our mitochondria, it's got to have the right fatty acids to run right. So before even worrying about blood sugar, what we should be doing is making sure our mitochondria are set up to do what they need to do, which is they need the right fats. They need the right fatty acids. So we got to measure that. Now on the on the nerve side, they say now that dementia in this country is going to be basically the type 3 diabetes, right? So
that's a term that's being used across the board now when it comes to Alzheimer's or Parkinson's and so forth. Lots of articles that are out there.
Exactly. So what's happening in those nerves, that damage is happening also in the central nervous system. So by measuring your function of your brain, and by the way, you're also really measuring the function of the peripheral, all the nerves as well, because the test requires you to do that.
Correct.
And what is the problem is nobody knows, like I said, where they are, and the most important organ in your body goes completely neglected when it comes to people really optimizing it. We don't do that for the heart. I'm sure all your listeners have had their blood pressure checked. Maybe a lot of them have been told they need a stress test. And this happens, on an annual basis for a lot of people. So, but the brain, we just wait. The nerves, we wait until something like you said happens, until there's like this problem, whether it's dementia or a diabetic neuropathy. And that's a shame, because we need to get way ahead of it.
Yeah, by the time I see a patient, they come in and they're saying, I think I'm having a problem, and what's going on? And they give me this litany of things that they're noticed, but they're too embarrassed sometimes to tell anybody else. And so I go through my normal pattern. I say, have you been in chronic pain? Have you, what's your diet like? What does that have to do with it? Because the traditional community doesn't look at those things. Optimally, we want to make sure that we have a balance in body function and biochemistry and emotional stress. We're never given the tools to handle that. So subsequently, we're eating up all these omega fatty acids. And when you look at our environment and see people say, well, I'm eating organic foods. Well, the problem is that organic is not just perfectly okay. Organic can be, an animal that's given organic foods, but they're still being fed the grains, and they're still being fed the sugars. They're still being, so there's a certain criteria. Organic is not necessarily free range, and free range, by the way, is not necessarily they're out there eating grass. Free range is let them out in the corral, and then they're putting corn and wheat and so forth and let them eat it off the ground. So those are the things that we don't look at, and we're still getting foods that are adulterated. And then you add that to the GMO products that are there, and unless it says organic non-GMO, you can get an organic food that's GMO modified. Mm-hmm. So all these things are affecting the nervous system.
Yeah, absolutely. And a lot of people, I think, are just confused. There's so much when it comes to this diet or that diet or this food. People are almost like paralyzed with not knowing what to do. Well, this is why the test, in my opinion, is so critical, because it tells you exactly what you need to do when it comes to the most important nutrient that you'll ever consume, which is the right fatty acids or fats, the omega-3 and omega-6s. And like you said, even if they are eating a certain diet they think is healthy, they may not be getting the right fat that constitutes, 60% of their brain. Our brains are mostly fat, and it has to be the right type, the omega-3 fats, to really work right. But the problem is most people have an inverse of getting of a bad fat and
tons
a low. Tons of 6, 25 to 1. Most of our patients test in the United States at 20 to 25 to 1 omega-6 to omega-3, and they need to be 4 to 1 or better. And that's right. That's for the brain. That's for everything else.
Sure.
That's a huge imbalance.
Cellular degradation, destruction of any tissue within the body continues to take place unless the fire is put out. And, you're talking about alkaline diet, and you're talking about making sure that you have the right availability. You and I had breakfast together this morning, and both of us had avocado, which is a highly alkalizing substance. And that helps put the fire out. It also has high levels of fats in it that are necessary, and they're good fats, but people don't do that. And they're constantly consuming things that are increasing the fire and fueling it to the point where they don't understand why, even though that they've done everything they can to make a difference, they've come into our office, and they've been treated by some of the best practitioners when it comes to applied kinesiological and acupuncture, but they refuse to change lifestyle. Mm-hmm. And so they still want to take a pill. So when you tell them, look, you're breaking down, and they go, oh my God. And here's the thing that we found. We love BrainSpan. We love this test, because it's, as I said, it's very predictive. But they'll take the test and they'll go to their physician. And some of these guys don't even know the research that exists within the medical community, within the allopathic community that's there. It's their own stuff. You have these hundreds and hundreds of articles that are being produced out there, and these guys are saying, oh, this is garbage. This is BS. It doesn't exist. How do you handle that? What do you do with that thought process? Because now, you've been in a traditional conservative community called the Army. Now you're going to go into, the tiger's nest, so to speak, and you're going to have to deal with it out in the clinical realm as well.
Yeah, and you just have to have a lot of patience, a lot of empathy, and thankfully, having gone through traditional medical school myself, I understand why they don't understand this, because they were never really taught. And even though a lot of this was published in, publications in the New England Journal of Medicine, that's considered, like the gold standard, it's a nutritional intervention. There's no drug that fixes these test values. It's all based on changing nutrition. And because of that, they don't necessarily get it pushed in front of them like they do the research in the areas of pharmaceutical drugs. And that's just the way the system is unfortunately kind of built. So when it's a nutritional answer, it's almost as if there's a curtain that goes up. When there's not a drug to cure it, it's actually just simply modifying your diet or developing a supplement program that works. And so I show them the research and they quickly say, oh, wow, okay, I didn't. So it's just really doing some hand holding and showing them the data, the research, and then realizing that, you know what, I know you're used to using a drug for everything that comes into your every problem, but this test, unlike all your other labs where it's really geared for prescribing a drug, this is geared for prescribing a lifestyle, a nutritional lifestyle. And while that's not something you were taught, I'm going to show you very simply how to do it, and you'll revolutionize the health of your patients. And then they sit down and listen.
Well, in kind of a macabre way, I'm kind of glad you're ending my circus, because it's you wait till you see what you're going to get bit when you get out there full time.
Yeah, that's probably true. The Army helped me in that regard too. I've got a few tricks up my sleeve. My guest in studio, my co-host this Wednesday evening, coming up, Dr. Dan Johnston. We're going to be talking about the brain on fire, omega fatty acids, amazing test called BrainSpan that will measure exactly what's happening that is allowing your brain to degrade. And if you're doing the right things, it actually measures the return, the reversal, as you're getting progressively better. We have patients right now, Dr. Dan, that are in the second round, of measurement, and we're seeing huge shifts, major shifts, based on some of the things that we're doing. So all of a sudden, the other pieces that we're doing for them are kicking in. They're working even bit better. It's funny. You have to prove it to the patient. You have to show it to them. And I'm the kind of guy that, doesn't like to order tests, but will order them simply because somebody's got to look at it. They got to see it. We're coming up to a break. It's that part of the program. We have to be very kind to those who bring you Dr. Tom Roselle live. But a fascinating program. Going to be a fascinating presentation Wednesday night. Don't go away. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle live, as you do every Sunday at high noon on the Eastern Seaboard. Those of you listening out in the West Coast, well, math 3 hours earlier. And those of you who are catching up online, well, they're all there for you. You can go to roselradio.com and listen to hundreds of programs that we've done over a period of many years, and they're all indexed for you. Or you can go directly to rosellcare.com, and within the next few days, you'll see this program hooked up and for your listening and re-listening pleasure. This Wednesday evening, Dr. Dan Johnston, Army medical physician who's getting ready to retire, created a company called BrainSpan Laboratories, measuring omega fatty acid levels and their relationship to neurological health and predictive measurement of crazy things like Alzheimer's and Parkinson's and dementia and all those things that we're so fearful of. It's incredible to me that, for so many years, things that we knew, Dr. Dan, on a clinical basis, just anecdotally from observing patients, knowing what their lifestyles were, we saw patients react. And we were talking about this the other day in the office, and this goes directly to the point. Our dietary patterns have so dramatically decreased, even within the last 20 years, compared to what they were when I started practice, 4 decades ago. And we were saying, people got better faster years ago than they do today. And, we were able to do things for them, and their immune systems responded, their body got out of pain faster. But today we see more and more chronic degrading conditions that the traditional community says we don't know why. But this test is to the point, and it shows exactly why these things are happening.
That's right. The analogy is, like if you think of a house, and a house made of wood that is soaked in lighter fluid is gonna catch fire sooner or later. And most people are walking around and their bodies are like a house soaked in lighter fluid. And traditional medicine, when the fire starts somewhere down in the basement, the firefighters show up and they just focus on putting out the fire. What we do is this test enables people to build a house out of stone, a house that is not, cannot even, go up in flames. And so it's shifting that paradigm to structure, function, and decreasing that potential to have inflammation. It's all about that potential. And that, once you change your fatty acids, and unfortunately, the system is set up against us. The way that we mass produce food, the way our fats have been altered since about the late 1950s in this country, it's very, very difficult to rebuild that house. But once you have the right information, and of course with somebody like yourself, you now have a roadmap. And that's the problem. People have no roadmap. And it's like in the Army. Without intelligence, you can't fight the enemy. You're lost.
No, you're spitting.
So this report, it's, that comes out from it, it's not only numbers, it's 8 pages of detailed information that alongside somebody like yourself or one of your staff, now they have all the intelligence to rebuild that house. And guess what? There's not going to be no fire. So, and if there is, it's going to go out like that. Like you said, they're going to be so responsive to other therapies. So regardless of what condition somebody might have, whether they're just trying to live optimally or whether they're fighting a cancer or heart disease or arthritis, you got to fix this, because then everything else you do will be that much more effective.
This Wednesday evening, my guest today, Dr. Dan Johnston, and I, were going to be sharing the platform. We're going to talk to you about the brain on fire, the neurological system on fire, brain health, neurological health, why things happen, very importantly, but how you can actually fix this. Those of you who are patients of ours, think about it. Have you done all the things that you're asked to do? Have you really changed the dietary patterns? Why do things kind of slow down in the progress? You hit a great place and all of a sudden you stop again. Did you kind of go off the wagon? Did you really fix it? There's these pieces that are so important. We're going to talk about those traumas and those injuries and those dietary indiscretions, and Dr. Dan's going to really put it together for us and how they can be measured, but more importantly, the predictability of, where you are right now. And by the way, Dr. Dan, and we've got about 30 seconds left, this is good for kids. I mean, their capacities are being limited because of this.
Oh, completely agree. It's a population that I'm so passionate about. You got to start early, because think about their brains, how rapidly they're developing all the way now, into their 20s. And if you start the earlier you start, the more benefit you're going to get, even in pregnancy.
There's so much that can be done, and we try to do that. We try to bring you the best of the best. My guest today, Dr. Dan Johnston. Please join us this Wednesday evening. Go to rosellecare.com or go to the phone number, 703-698-7117, and register for this class, because, as you can guess, it's going to be limited. Love you all. See you next time. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Yourself. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.